I'm back.
Good morning, everyone, or good afternoon. We're having a couple little tech issues on our end, so we'll get started here in just another couple of minutes. Thank you.
Ready? Okay. Good Thursday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. This is National Public Health Week. So our moment of gratitude today is dedicated to all those here on our team and around the country who are working in this important field. I believe I can speak for most in public health when I say that it's been a difficult and exhausting year, but also one where our colleagues here and across the country have stepped up over and over and over again to protect our communities. I'm incredibly proud of the work our team has done over the past year, and I'm honored to work alongside with them every day. We'll now bring up our vaccine information webpage for updates. There have now been more than 237,000, sorry, having trouble reading today. 237,000 vaccines administered in Knox County to Knox County residents. And more than 33% of Knox County residents have had at least one dose, giving them some level of protection against COVID-19. We still have a way to go, but I'm very pleased with the progress we've made so far. Are we good? Please remember that if you're unsure of whether you'd like to take the vaccine, I encourage you to have a discussion with your medical provider. There's a great deal of misinformation online, and especially on social media. So please be cautious and make sure you're making your decision based on factual information. This is one reason why it's so very important to discuss any concerns you may have with your provider. We'll now move on to the local COVID situation. We have 40 new confirmed cases since yesterday's report. We have 876 active cases. 35 Knox County residents are currently hospitalized. And we have no additional deaths to report today, keeping our total at 618. And now we'll move on to the benchmarks. As a reminder, all of the data is available on our website at covid.knoxcountytn.gov. The first benchmark, sustained reduction or stability in new cases for 14 days. In the past 14 days, the average number of cases per day was just above 54. And in the past 7 days, this number was approximately 48. This is slightly better than the previous week's figures, but not where we need to be. Because of these factors and a slight uptick in cases in previous weeks, this benchmark remains yellow. Second benchmark, community-wide, sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding lab turnaround time, this figure remains less than 2 days on average. For the volume of tests, we saw a decrease we had over 4,200 tests the week before and approximately 3,900 tests reported during this reporting period. Because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capabilities. During the past week, more than 24,000 vaccines were administered. That's down from 28,000 the week prior. We believe this is likely affected by the holiday weekend. and is hopefully an anomaly in an overall increase in distribution. We do expect weekly administration of vaccine to level off in the near future as more people get vaccinated. So we will continue to look at this benchmark regarding how we evaluate it. For these reasons, we are representing this benchmark as yellow. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. Over the past few weeks, we have seen the number of hospitalized COVID patients plateau. We'd like to see this decrease. However, the hospitals are still well within their capacity. After speaking with our hospital partners, they recommend that this benchmark be represented as green. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. The average number of deaths reported over the 7 and 14-day time period were just about 1 per day. This information available leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14 and 7-day trend lines showed 10 new cases per 100,000, both of which remained fairly constant. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 8.4%. And now I'll open it up for questions.
All right. If the members of the media on the call will go ahead and enter their questions into the chat feature. And please remember to identify which organization you're with as you enter your question. Up first, we have a question from Scott with Compass. How will Dr. Buchanan handle the existing public health orders? Does she have to issue new orders identical to the existing ones? If so, when? And if you do, you plan to alter those orders?
So at this time, we've learned from the law office, yes, I will have to issue new orders if I wish to keep the regulations in place. And I will be keeping the mask mandate in place as is, and probably keeping the current restaurant limitations in place until they were supposed to expire anyway on the 22nd, and have that discussion with the Board of Health Advisory Board on the 21st.
Second question from Scott with Compass. Has Dr. Buchanan spoken with Mayor Jacobs? And if so, what can she tell us about the conversations?
I have spoken with Mayor Jacobs, and his opinions on regulations are not a secret. He certainly has some concerns. We'll continue those conversations. Currently under the law, the health officer, the health department has the authority to put regulations in place that we see are appropriate, and we'll be moving forward with that.
All right, Elise from WBIR. There are tons of open vaccine appointments in East Tennessee. Are you concerned that some vaccines will soon expire because those appointments are not being filled?
So I only know about our vaccine. I don't know the expiration date of other people's vaccine. So we don't have tons of appointments available. To my knowledge, I'm looking at Dina, who's our director of nursing. So you would have to ask the folks who have tons of appointments available if they're concerned about their vaccine expiring.
All right, from Brian Hornback. When is the next health board meeting?
April 21st at 5 p.m.
Austin with WATE. Can you give us an update on the new vaccine registration system? Any issues, and are lots of people taking advantage of this?
I'm again looking at Dina. I think our appointments are filling up as we make them available, and the feedback we've gotten from the public is positive. It's easy to use and helps people get registered quickly. And also, if we don't have appointments, it takes you to the vaccinefinder.org page, which is your best resource. If we don't have an appointment, go there to find where you can get a vaccine.
All right, a couple more from Austin with WATE. What is your opinion on masks in school this next year? How long would you encourage mask wearing?
As I stated last night to the Board of Education, I recommend that we follow the CDC guidelines, as those change based on disease rates and based on data. I can't predict what those guidelines will be in the fall and how long those will be in place if we were to start school, or we're in school now. But right now, the CDC continues to recommend along with the Academy of Pediatrics, the National Institutes of Health, the World Health Organization, that children in school wear masks when they can. And so we continue to agree with that and continue to support that, and we'll change our guidance based on the data and evidence from the CDC and other experts.
All right, again, from Austin with WATE, with some areas having a harder time getting shots to people because people aren't signing up, will KCHD get any additional allocations from those areas?
So we'll talk a little bit about how the allocation system works. So the state allocation system, the federal government tells the state of Tennessee how many vaccines they're getting this week, and then the state divides it out among all the population across the state, and uses some other factors to determine where vaccines should go. And once those areas are offered vaccine and say they can't absorb all the vaccine that's available to them, then the state offers vaccine to other areas that have deficits in need. So they have more demand than supply. And that usually ends up being the metro areas like Knox County, Davidson County, Shelby County, Hamilton County, Sullivan, Jackson, Madison. So they're trying to make sure they use every vaccine that comes into the state. So they're wanting to put it in a place where it will get used. So it kind of varies. There's no set answer to that. They try not to send it there and have to move it again. They try to send it to one place. That just makes tracking much easier. As you can imagine, it's thousands of doses of vaccine going to hundreds of different places. And so it's a lot easier to send it to one place and not have to move it around after it gets there.
From Elise with WBIR, there seems to be vaccine hesitancy. Is KCHD working to combat that in any way?
There certainly is vaccine hesitancy. And yes, we are working to combat that. We are working, we've created educational videos that are being shared out on social media. We actually did some fun little grant projects with some nonprofits that work with like the Latino population, the African American population, the immigrant population, where we see a lot of vaccine hesitancy, to create some messaging to encourage vaccination. And so we're doing a lot of different things to encourage people to get vaccinated. You know, these vaccines are safe and effective. All of them are safe and effective. You know, we have 237,000 people who are not 237,000 people, but 30% of our population can attest to the fact that the vaccines are safe because they've gotten them and they're fine.
Vincent with KnoxNews, have you spoken to any of the members of the county commission since your address last week? And if so, how did those conversations go?
I haven't had any conversations with any commissioners since last week.
All right, Claire with WUOT, was every person on the wait list contacted before the wait list closed last week?
Yes, it was. Yes, they were.
And a couple more. Are you still maintaining a last minute wait list for any leftover vaccine at the end of the day?
So we changed our model on that a little bit, but yes, we still have that. You have to sign up for it daily. We just found actually experience across the state and other places demonstrated that that was a more efficient way to do it, because that way, if somebody happens to get a vaccine somewhere else, they don't have to sign up again. And so, you know, we did reach out to everyone on the wait list. Does that mean we talked to everyone on the wait list or connected with everyone on the wait list? No, because sometimes they didn't answer their phone or reply to the text. So we made an effort to reach out to everyone on the wait list, and some folks just didn't connect with us. Hopefully they got a vaccine somewhere else, and that's why they didn't answer their phone.
And last one from Claire, is there a specific day of the week or time of day when the new appointment slots are added to our portal?
Not at this time. We don't have a schedule for that. We want to know we're going to have vaccine before we open up appointments, because we really don't want to open up appointments and have to cancel. So, you know, there's a process for that. And so we don't have a set time right now, to be honest. We're working through a whole lot of second dose clinics. And so we have not as many first dose appointments as we'd like. Let's see, is it in 2 weeks? We'll 2.5 weeks, we'll open up more first dose appointments, because we'll be through some second doses and into our rhythm of being able to do 500 first dose appointments and 500 second dose appointments on the same day.
All right, Brian Hornback, has the Knoxville Academy of Medicine submitted a replacement name for Dr. O'Brien? And when might that happen if it hasn't?
Well, they haven't. I needed to get clarity from the law department about what was going to happen to the Board of Health and how that would work. And so I have that information now, and so we'll make an official request to the Academy of Medicine to nominate a replacement.
All right, if there are any additional questions from the local media, please go ahead and submit those into the chat feature. Claire with WUOT, how can people sign up for that leftover vaccine daily wait list?
When you go to our website, go to the vaccine information page, and there's a link there that I don't know what it says, but
it's referred to as the standby list, and you can sign up there.
sign up for the standby list.
And this is Catherine, and I owe an apology to Vincent. I seem to skip a question. I'll now go back and read that one. My apologies, Vincent. Do you feel adequately supported by the county government in your capacity as the health officer, now that the Board of Health is strictly advisory?
Well, what I will say is I'm appreciative of them keeping the Board of Health advisory because I do think that's really important. These are really big decisions, and they are not taken lightly. And having a panel of experts to bounce ideas off of and discuss things with is very important. So I'm appreciative of them keeping that in place. To have done away with the Board of Health and not kept an advisory committee of experts and professionals would have been more challenging.
All right, if there are any more questions, please go ahead and submit those into the chat feature. All right, seeing none, that will be all for today. Thank you very much for your time, and we hope you have a great rest of the afternoon.